Hello everyone, hope this video will find you all in a good health. Myself Dr. Parth Goswami, and today I will teach you a very important topic from hematology, that is hematopoiesis and hematopoietic niche. This particular topic is very important for undergraduate, postgraduate students as well as for any medical person. So guys, what do you mean by hematopoiesis? So simply, a hematopoiesis means it is the physiological process of formation of blood cell from the hematopoietic stem cell. Here guys, blood cell means red blood cell, white blood cells, platelets, lymphocytes, etc. So their formation process is known by the name hematopoiesis, and this particular production is happening from hematopoietic stem cell. Now you might have questioned that where the stem cells are located. So stem cells are located in a bone marrow, and the bone marrow is present in the medullary cavity of various bones. Particularly in the adult, bone marrow is located in pelvis, skull, vertebra, sternum, etc. So guys, these hematopoietic stem cells will lead to formation of all type of blood cells. They are the pluripotent stem cells. These stem cells is having the two important property. They can proliferate to produce a similar stem cells. They can produce more number of stem cells from one stem cells. That property is known by the name self-renewal. The second important property of hematopoietic stem cell is that they can differentiate into various progenitor cells. That property is known by the name differentiation. So these two are very important property of hematopoietic stem cell. Alright, now guys, as we have discussed, it can differentiate into the progenitor cells. Now guys, you have to remember that the hematopoietic progenitor cells is having very important property in the form of lineage commitment. These progenitor cells are lineage committed cells. They are committed to only one lineage. That is very important property. I want to say that lineage commitment means they will be committed to only one lineage, either to the myeloid or they will committed to lymphoid lineage. Now what is the importance of understanding this lineage commitment? So guys, I want to say that if progenitor cells that are produced from stem cell, if they are committed to myeloid lineage, then they will form WBC, RBC and platelet. So this will be formed from myeloid lineage, and if stem cells are committed to lymphoid lineage, then they will produce a lymphocytes. So from these two lineage type of stem cells, different type of cells will produce. That is the importance of understanding the property of progenitor cell. Now guys, you have to remember that as the maturation progress, the progenitor cells is having a less proliferative potential as compared to stem cell. The highest proliferative potential is seen only in the stem cell, hematopoietic stem cell. After that, proliferative potential will be decreased. Alright. Now guys, these progenitor cells is having a receptor for binding with certain type of growth factor and cytokines. For example, I want to say that erythroid precursor is having the receptor for binding with erythropoietin, and granulocyte precursor is having the receptor for binding with granulocyte colony stimulating factor. So whenever these cytokines or growth factor will bind to the progenitor cell, then the maturation will occur, and then finally cells can produce. So the progenitor cell is having receptor. Alright. Now as the progenitor cell matures, means whenever such erythropoietin or GCSF will bind to their progenitor cell through the receptor, the progenitor cell will get mature, and with the maturation proliferative potential will get decreased, and so finally you will have mature red blood cell, platelet and white blood cells. So that is the in short process of hematopoiesis. Now I will explain this process in a detail. Alright. So guys, myeloid lineage committed stem cells is known by the name CFUGEMM, means colony forming unit, granulocyte, erythrocyte, monocyte, megakaryocyte. Such name is given because guys, these myeloid stem cells will produce granulocyte, red blood cells and platelets. That's why it is known by this name. And guys, you have to remember that hematopoiesis is regulated by two main important factors. Hematopoiesis happen only if it is regulated by two main factors. One factor we have already described, that progenitor cell is having the receptor for binding with cytokines and growth factor. So first factor, you need a cytokine or growth factor for stimulation of the stem cell. Second important factor is stromal cell. These stem cells are located in a bone marrow, and in the bone marrow there is a presence of stroma which will provide a nutrition to the growing stem cell. So the stromal cell is also needed. So these two important factors is needed for the hematopoiesis process. Alright. Now guys, this is the master chart that is prepared by me. This is a very important master chart for understanding how hematopoiesis happen in our body. So first of all guys, the process start from hematopoietic stem cell. You have no doubt regarding that. Now guys, this hematopoietic cell can be committed to two type of lineage, either myeloid lineage or they will committed to lymphoid lineage. From both these committed lineage, there will be formation of different type of blood cells. So first we will talk regarding myeloid committed lineage stem cells. So if stem cells are committed to a myeloid lineage, then guys they will produce a 6 type of cells. They can produce a red blood cell, platelets, basophils, neutrophils, monocyte and eosinophil. These 6 type of cells can be produced from myeloid committed lineage stem cells. Now we will understand how this particular complex mechanism happening in our body. So first of all guys, whenever the stem cells are injected in a tissue culture medium for growth, according to the growth factor and cytokine, they are committed to sublineage cells. They will be committed to either producing RBC, either producing platelet, or they are committed to produce WBCs. So accordingly, collectively, they are known by the name colony forming unit. Right? Now, if colony forming unit is committed towards the formation of RBC, then it is known by the name colony forming unit erythroid. Under the effect of erythropoietin, this erythropoietin is a growth factor or cytokine. So they will bind to this progenitor cell CFUE, and after binding with this CFU erythroid, they will get differentiate into a immature blast cell, that is pronormoblast. From the pronormoblast, you will have the production of basophilic normoblast, which is also known by the name early normoblast. They will differentiate further into intermediate normoblast, which is polychromatophilic normoblast, and finally it will get a differentiate into late normoblast, which is also known by the name orthochromatic normoblast. From the late normoblast, there will be production of reticulocyte, and finally with the exclusion of nucleus, your mature red blood cell will form. So this is the process of formation of red blood cell. So we can say this process as a erythropoiesis, because here there will be production of red blood cells. So this process is known by the name erythropoiesis. Erythro means red blood cell. Alright, so this is about the formation of red blood cell. Now if this myeloid lineage committed stem cell are directed towards the production of platelet, then they are known by the name colony forming unit megakaryocyte. Now guys, here thrombopoietin, interleukin 3 and interleukin 6 will bind to this progenitor cell and they will differentiate this CFU megakaryocyte into a megakaryoblast. They will be further differentiated into pro-megakaryocyte. From the megakaryocyte will form, and with the exclusion of cytoplasm of this megakaryocyte, there will be production of platelet. The cytoplasmic budding of megakaryocyte will produce a small size granular platelets. So this is the process of formation of platelet, which is known by the name thrombopoiesis. Thrombo means platelet. So this particular process is known by the name thrombopoiesis. Alright. Now guys, if they are committed towards the formation of white blood cells, particularly basophil, neutrophil and eosinophil, then they are given the name CFU baso, colony forming unit granulocyte or colony forming unit eosinophil. So first of all, under the effect of growth factor, particularly granulocyte monocyte colony stimulating factor GM-CSF and interleukin 3, they will get differentiate into myeloblast. These growth factors will bind to progenitor cell CFUG and they will produce a most immature cell, that is myeloblast. From the myeloblast, there will be production of promyelocyte. It will get further differentiated into myelocytes. From the myelocyte, there will be production of metamyelocytes, and from which finally you will form the band cell and neutrophil. So this is the process of formation of white blood cell, particularly neutrophil. Now according to the growth factor and cytokine, basophil or eosinophil also can get produced. If interleukin 3 is the predominating cytokines, then CFU baso will get converted into basophil. Finally basophil will form, and under the effect of interleukin 3, 5 of GM-CSF, eosinophil also can be formed. For the production of neutrophil, basophils and eosinophil, the process is similar. The immature cells are similar. So such production of WBC is known by the name leukopoiesis. Right? Alright. Now from the CFU monocyte, there will be production of monoblast, which will get differentiated into promonocyte, from which there will be production of monocyte. So in that way monocyte will get produced. And guys, this monocyte in the tissue is known by the another name, that is macrophage. So the monocyte in the tissue is known by the name macrophage. So guys, in short, this is all about the production of different type of blood cells from the myeloid lineage committed stem cell. If red blood cells are produced, then this is known by the name erythropoiesis. If platelets are produced, then that process is known by the name thrombopoiesis. And if neutrophil monocytes, eosinophil or basophils are produced, then such white blood cell production is known by the name leukopoiesis. So this is all the process of formation of these 6 important type of cell from myeloid lineage committed cells. Now guys, if hematopoietic stem cell is committed towards the lymphoid lineage, then from lymphoid lineage committed stem cell, either you will produce a pre-B cell or there will be production of pre-T cell. Now under the effect of interleukin 1 and 7, this pre-B cell will get converted into mature B cell. This mature B cell is getting converted into plasma cell whenever there is an antigen exposure. So this plasma cell will produce the antibody. So whenever we have the antigen exposure, this B cell is getting converted into plasma cell for the production of antibody. So this is a very important MCQ, that antibody production is happening from plasma cell. Alright. Now under the effect of interleukin 2, 4 and 7, the pre-B cell will get converted into T lymphocytes. So from the lymphoid lineage committed stem cell, there will be production of B and T lymphocyte, which is seen in this diagram. So that is about the formation of different type of blood cells from the myeloid lineage committed stem cells and lymphoid lineage committed stem cell. Now guys, this lecture is about understanding hematopoiesis. That's why I will not describe the morphology of all these type of megakaryocytes, normoblast and myelocytes. I will describe morphology of each type of cell in some another lecture. Now guys, here one important point you have to remember is that whenever these immature cells are getting increased in your bone marrow and in the peripheral smear, if these immature cells are increased in your bone marrow, then it will get released into the blood, so it can be detected in peripheral smear. So if these immature cells are tremendously increased in your bone marrow, then that process is known by the name leukemia. It is a form of blood cancer in which the immature cells are increased to a tremendous level. And if the increased immature cell is of myeloid lineage committed cells, then that leukemia is known by the name myeloid leukemia. Remember guys, in the myeloid leukemia you will have increase in the myeloid type of cells. If lymphoid type of cells are increased tremendously, then such type of leukemia is known by the name lymphocytic leukemia. Right? So that are the basic two types of leukemia, myeloid leukemia and lymphoid leukemia. We will discuss regarding the leukemia in the detail in some another lecture. Alright. Now which are the site of synthesis of different growth factors? We have discussed that GM-CSF, interleukin 3, interleukin 6, erythropoietin are very important for stimulation of progenitor cells. So from where they will get produced? So first of all, GM-CSF, granulocyte monocyte colony stimulating factor, will get synthesized from the T cell, fibroblast and endothelial cells. GCSF will get produced from monocyte and fibroblast. Erythropoietin will get produced from the kidney. This is very important MCQ. Because guys, whenever you have the kidney disease, if you have the kidney disease, then erythropoietin will not get produced. And because of less erythropoietin production, the RBC formation will not happen. Your erythropoiesis process will get disturbed, and so the patient will develop anemia. That is the reason why in kidney disease patient there will be anemia. Alright. The thrombopoietin is getting produced from the liver, and that is the reason why in the liver disease the thrombopoietin production is getting decreased, and so less platelet will form. That's why in the liver disease you will have low level of platelet, which is known by the name thrombocytopenia. Alright. Interleukin 3, 5 and 6 will get produced from the T cells as well as from the fibroblast. Alright. Now guys, we have discussed the whole process of hematopoiesis, but you might have questioned that which is the site for hematopoiesis. So obviously we have discussed that hematopoiesis is happening, hematopoiesis process start from the stem cell, and the stem cells are located in the bone marrow. But guys, this is not the fact for embryo. Until the 3rd week, this hematopoiesis is happening in yolk sac, and up to the 3rd month of life, the hematopoiesis is happening in the liver. After the 4th month, bone marrow is becoming a sole site for hematopoiesis. Until then, the yolk sac and liver are the main site for hematopoiesis. Alright, from the birth, the bone marrow is the only sole source of blood cell production. It is the only site of hematopoiesis after your birth. And guys, you have to remember clearly that in the childhood, all the bone marrow is red and hematopoietically active. Means the hematopoiesis is happening in all type of bones where the bone marrow is present. But once you become the adult, means once you cross your 18 year of age, the site of hematopoiesis is limited to particular portion of bone marrow only. Means the hematopoiesis happen only in vertebra, ribs, sternum, skull, pelvis, and proximal epiphyseal region of humerus and fever. And that is the reason why, if in the adult you want to take a bone marrow, then you have to choose one of these site. Alright. So the hematopoiesis in the adult happening only in these bone marrows. Alright. Sometimes guys, what happen in thalassemia like that of hemolytic anemia, you need a more red blood cell production, and that's why sometimes extramedullary hematopoiesis can be seen in adult in the liver. It is only when you have the hemolytic anemia. So that is known by the name extramedullary hematopoiesis, and that will happen in the liver and spleen. So in the adult, liver and spleen is not the site of hematopoiesis, but in hemolytic anemia, liver and spleen can become the site for hematopoiesis apart from bone marrow, and that is known by the name extramedullary hematopoiesis, and that is the reason why in hemolytic anemia liver and spleen is getting enlarged. Alright, now guys, what do you mean by hematopoietic niche? So guys, these hematopoietic stem cells are located in the bone marrow. So that location in the bone marrow where the hematopoietic stem cell is live in the bone marrow, the residency of stem cell in the bone marrow is known by the name stem cell niche. So it is the house for hematopoietic stem cell. Alright. So obviously in the hematopoietic niche you have the stem cells. But apart from stem cells, there can be presence of other type of cells like that of Kerr cells, macrophage, osteoblast, osteoclast, and endothelial cells. So such type of cells can be seen apart from stem cells. And in the hematopoietic niche, there will be stem cell renewal and differentiation. The cell to cell interaction is also occurring in this niche. Now guys, if this hematopoietic stem cell in the bone marrow residing near the bone, if they are located near to the bone means bony trabecula. If they are near to the bony trabecula, then they are known by the name osteoblastic niche or endosteal niche. So the area where stem cells are located near the bone is known by the name osteoblastic niche. Similarly, if hematopoietic stem cells are located near the blood vessel or near the sinusoids, then that area is known by the name vascular niche. So there are two main niche in the bone marrow for the hematopoietic stem cell. Either they will lie near to the bone or they will reside near to the vessels or sinusoids. So these two are the main niche or the site for the hematopoietic stem cell. Alright, so first we will talk regarding the osteoblastic or endosteal niche. So obviously the stem cells are located adjacent to the bone in this area. And guys, in this area there are more number of hematopoietic stem cell as compared to vascular niche. But the main disadvantage is that guys, these hematopoietic stem cells express a osteopontin, and this osteopontin will reduces the stem cell proliferation. That's why the stem cells that are located in osteoblastic niche could not get proliferated or differentiated. So these stem cells are quiescent. So the stem cells in the osteoblastic niche are quiescent. They cannot get proliferate or differentiate. Alright. But guys, the cells that are hematopoietic stem cells that are located in the vascular niche can get proliferate and differentiate. So the hematopoietic stem cell proliferation and differentiation according to the need will happen only in the vascular niche. In the vascular niche, the stem cells are located in the central portion of bone marrow where you have the blood vessels and sinusoids. Alright. The main another important of the presence of stem cell is that they are located near to the blood vessel, so they can directly enter into the blood vessel and they can go into the circulation. So for the circulation of stem cell, this vascular niche is very important. As they are located near to the blood vessel, they will show the positivity for vascular marker, particularly CD34. They will show the CD34 positivity. So I want to say that hematopoietic stem cell in the vascular niche sense the signal, and accordingly they can change their self-renewal, proliferative and differentiative potential. So the proliferation and differentiation occur in vascular niche, not in this osteoblastic niche. Alright. Now guys, this particular diagram showing a two important niche very clearly. You can see that these hematopoietic stem cells are located near to the bone. That's why they are known by the name osteoblastic or endosteal niche. And whenever there is a need, they can migrate to central portion of bone marrow where you have the sinusoids and blood vessel. So the stem cell in the central portion of bone marrow near to the blood vessel is known by the name vascular niche, and they can enter into the blood vessel and finally into circulation of our body. So for the stem cell homing and circulation into the body, vascular niche is important. So this is a very important MCQ guys. Remember, there are two niche in a bone marrow, endosteal niche and vascular niche. Alright, so guys, this is all about the hematopoiesis and hematopoietic niche. Hope it will make your fundamental clear regarding the hematopoiesis. Thank you very much guys, and I will back with a new video within few days. So like, share and subscribe the channel. Thank you very much. See you soon, and until then, take care. Goodbye.